third of NHS contracts in England have gone to private sector providers. Cue outrage. But is paranoia about the private sector justified? Our figures suggest not. Also tonight...
Hang on, Alex, here's your bust.
Take the tape of Marty bust away.
Kirsty goes head-to-head with Alex Salmond. And it was a theory few had even heard of. Now it's been trashed anyway. What the Rosetta space mission has revealed about our planet. Hello, good evening. For anyone concerned about the creeping privatisation of the NHS today, these figures that a third of NHS contracts in England have been awarded to private sector providers since 2013 could send a chill down the spine. Until, that is, you look at the data behind the headline, which is what our policy editor, Chris Cook, did. His number crunching reveals that patients have, on average, a better outcome from treatment from private providers working for the NHS at the same price across a range of treatments than they do on the regular NHS. So are the fears misplaced? Here's Chris in more depth.
The English NHS is casting a shadow over Westminster as the service puts in place the coalition's pro-market reforms. Today, the BMJ, a medical journal, revealed that in the reform's first year or so, around 1/3 of local NHS contracts that came up were awarded to private providers by local GPs. So what exactly does private provision mean? Well, first of all, it doesn't mean that patients have to pay. They still don't. But it does mean that if your doctor refers you for treatment at a hospital, they might not send you to a traditional NHS one like this, St Thomas's in central London. They might send you to an independent treatment provider. That's usually a much smaller sort of institution, and it may in fact only do 2 or 3 simple things.
GPs are passionate about the NHS. There is no clinical commissioning group that has an agenda to privatise NHS services. What we are passionate about is improving the services the patient can access. And sometimes that does mean using other providers. But I want to be really clear, this isn't a new subject. This tendering in the NHS has been around long before clinical commissioning groups, well before 2010, and in actual fact there's only been a 1% increase in private provision in the NHS in the last 4 years.
The coalition reforms did allow more private provision, but the use of non-NHS providers isn't new. In fact, it didn't grow particularly quickly in 2013-14, when it edged up to just 6% of health spending.
Without doubt, this is the thin end of the wedge. As long as we have that Health and Social Care Act in place, then the NHS will be forced to put services out to tender. And we're not just talking about extras here, we're talking about whole services, vital services, like care for the elderly and for cancer patients. £1 billion worth contract in Staffordshire up for grabs as we speak. I think people are worried about that, they're right to be worried about that, and that's why we need to see the repeal of that act.
So what does this mean for patient care? Well, the best way we have to answer that question is through a set of data called PROMs, Patient Reported Outcome Measures. What we do before people have a small number of very common operations is we give them a questionnaire that details how exactly they feel. Then, after the operation, we give it to them again. And by comparing the 2 results, we can see what the impact of the operation was. And we can see which hospitals are better at making patients feel better. So let's take a hypothetical 70-year-old patient who needs a hip replacement. And let's say they've got a PROM score of 50 out of 100. That's painfully low. Newsnight analysis shows that that patient could expect a score of 78.9 out of 100 after surgery at an NHS provider. But she could hope for an 83.9 score from a private provider. That's significantly better. You see the same effect with knee replacements too. Patients feel better for the same price to the NHS. Now, these are the only 2 operations we can do this analysis for, but it's not a bad start. Altogether, we do more than 100,000 of these operations every year.
It's not surprising sometimes that private hospitals do get better outcomes for some areas, given that they haven't got the acute workload, so the urgent, for example, fractured hips surgery that needs to go on at the same time. So I think that that it's not surprising this happens, but as commissioners, it's really important that we treat all providers the same and that we look at the quality they provide closely.
Still, this research is just the start. Labour is nervous about growing private provision, and we'll probably find clinical areas where patients think full-service NHS hospitals do best. The sun won't set on the argument on profit in healthcare anytime soon.
That was Chris Cook, and he'd discuss this further. Jackie Davis, co-founder of the NHS Consultants Association, and Robert Webster, the chief executive of the NHS Confederation. And that was an awfully big sigh you let out, Jackie, as you were watching that report. But it blows that fear out of the water, doesn't it, when you actually come up with concrete data, however small, that suggests the outcomes for the patient are better.
The truth is we don't know what the outcomes for the patients are in the private sector, because what you're doing there is asking some people what their personal experience was. But what we've got to look at is what happens on a population basis to people who are treated by the private sector.
Doesn't that count then? Doesn't it count what people think of their own medical experience?
Yes, absolutely it counts. But if you were to tell patients that an investigation by a progressive think tank has just turned up the fact that there have been 800 extra deaths in private hospitals treating NHS patients, then they might think, do I really want to go to that place? Because a lot of these hospitals do not have appropriate facilities for dealing with emergencies, for dealing with unexpected things.
But we're not talking about those 800 extra deaths as private providers for the NHS, are we?
Yes, we are, yes.
Rob Webster.
So I think we have to look at that report and see what it actually says, which is that you can't get from the data that those deaths were extra or that they could have been avoided. I think it actually says that in the report. What's clear is that any provider of NHS care has to be registered with the Care Quality Commission, has to meet the right sort of standards clinically and financially. And I think this debate that we're having is exactly the right one.
But do you think these numbers, just to sort of bring you to where we are now, do you think these numbers suggest that this private provision is the right way to go? Is that your direction of travel now?
No, I think my direction of travel and the direction of travel of commissioners and NHS trusts and private providers is we should be much clearer about three things. You know, our service is safe, what's the patient experience like, and what's the outcome like? And one of the things that I think we both agree on is that we should be much more transparent about the data that is produced, so it's not for the BBC or others to say compare what the outcomes are, but what we should do is compare them through the NHS My Choice system.
Scaremongering, isn't there? When you see somebody like Francis O'Grady talking about the thin end of the wedge and people must be very afraid, and actually the figures do not back that up.
It depends what figures you look at. You know, if you were to say to patients, as has happened already, that your GPs are outsourcing the musculoskeletal services close to you to the private sector, and therefore there may not be an orthopaedic service in your local hospital when you do something the private sector can't deal with, such as break your leg. Do you think it's such a good idea that that happens? Because what's happening is that the sorts of services that are going out to the private sector now are destabilising, truly undercutting the NHS's basic function. And when this figure
What do you mean they're undercutting? I mean, presumably, if they're doing some services more easily, then the NHS can charge more. You can start pricing according to what that is, right?
If you take the musculoskeletal services away from a local hospital, as has happened in the south of England, then the hospitals are paid by the work that they do. So you take the cheap and cheerful stuff away from them. That's what the private sector does. It cherry picks the cheap and cheerful stuff.
Well, then the NHS can charge more for the ones that are more difficult to do.
No, but they're not going to get.
Pricing.
No, they're not going to get more. That doesn't happen. So the orthopaedic, you then lose your orthopaedic service in the local hospital. They can't afford to run it.
Okay.
That has a knock-on effect on the A&E department, and therefore you lose your A&E department. And they're already saying that down in Brighton. The two local hospitals are saying,
so
if
this
you
is a
do
concrete example of where actually having the private providers are not helping at all.
No, I would disagree. I think what we've got to do is look at this in the round, and commissioners decide how services should be delivered locally in terms of which services are going to be tendered to go to the private sector.
But do you agree they are cherry-picked? Do you agree that...
Well, patients decide and GPs refer to services. I don't think that you can cherry-pick on that basis. If the commissioners are specifying what the services are, how can a private provider cherry-pick? I think it's one of those scaremongering arguments that we need to get away from.
We don't say that about GP practices. We know that there are partnerships there, there are investments in that. We don't say that about dental work and dentistry and podiatry and all the things that people seem to readily accept will have private service providers.
We don't say what, sorry, that they...
We don't say it's the thin end of the wedge, it's a slippery slope and people will be left without any access to services.
What we're seeing with these figures is I mean, there's a lot of stats being bandied about, and one of the statistics that needs to be looked at is, oh, it's only 30% and, you know, it's 5% of the... The private sector do not want a lot of NHS work because it's the acute work, it's not profitable for them, so they are winning a much bigger percentage of the work that they want. And for instance, somewhere between 15 and 20% of elective surgery is going to the private sector now, which has definite effects on the local NHS.
Last word, Rob Webster.
Well, the capacity we require to meet the targets that are enshrined in the NHS Constitution around waiting require us to have that capacity. So I think we need the independent sector working alongside the NHS. The vast majority of care is delivered by the NHS for the NHS.
OK, thank you both very much. Thanks for coming in.
Thanks.
Now, even as the revelations of CIA torture rocked America, it seemed unlikely